everybody, how are you all doing? I'm back with another video about nursing in the UK as a foreign trained nurse, and in this video we're going to be looking at the differences between working in the NHS Trust and in the nursing home, so you guys can have enough information when you make this decision. So we're just going to jump right into it and start off with the pros and cons of working in the NHS Trust. Now, obviously, the number one pro of working in the NHS Trust is the career advancement. When you work in the NHS, you can start off in any unit of your choice, and you don't necessarily have to go back to school to be able to do this. The NHS Trust is going to train you on what to expect and also your nursing responsibilities in that unit so that you can function properly. Now, if you decide that you want to gain more exposure and move to another unit, the process of transitioning is also very easy. All you need is just training from the trust for you to know what to expect in that new unit, and you are good to go. Now, when you have decided to go round, you've gained a lot of exposure, you've gained a lot of new skills, expertise and all that, and you've settled on the specialty that you love. A lot of NHS Trusts have loan opportunities for you to go back to school to get the academic qualifications that will enable you to progress in that your choosing specialty. Apart from that, the NHS Trust also provides mentorship support from trained mentors to their staff. So a lot of nurses have two mentors, the clinical mentor and the associate mentor. The clinical mentor is there to guide you with your nursing skills to make sure that you are doing things the right way. So when you have a clinical mentor to run to guide you, you find out that the fear of losing your pin is reduced, so you can work with peace of mind. You are not really tensed up and afraid of every little decision you take. The associate mentor is going to help you with your career growth, so they are making sure that the goals that you set to achieve for yourself, that you are actually on the right path to achieve those goals. Another advantage of working in the NHS is the development of your clinical and pharmacological skills. Clinical skills in the sense that you are constantly undergoing training and appraisals that will build on your existing knowledge, and because you are exposed to different situations, different scenarios, you are also able to pick up on different nursing skills and expertise that you can also transfer to any setting in any part of the world that you decide to work in the future. Pharmacological skills in the sense that because you are working in a big population or in an environment that is seeing a lot of patients with different medical conditions, you are also able to build on your pharmacological knowledge. You will be exposed to new medicines, new medications, and different routes of drug administration, as opposed to the nursing home where you are only given the oral medication and the IM routes. Another advantage of working in the NHS Trust is the job security. The NHS is a government-owned industry, while the nursing home is a private-owned company. So it's easier for you to lose your job in the nursing home than for you to lose your job in the NHS Trust. Another thing you should consider is that if you want to get a loan, like let's say a mortgage, a car loan or school loan, it will be easier for your lender to give you that huge amount of money you are asking for if they know that your job is secured. Don't misunderstand me. I'm not saying that those that work in the nursing home cannot get loans. They can get loans, especially if you've worked in the nursing home for a very long time or you are working for an A-rated company. But it will be easier for you to get that same loan if you work in the NHS hospital than in the nursing home. Another advantage of working in the NHS is the upward review of your salary. Unlike in the nursing home where your salary is constant according to your contract. So for example, we come in with 3 years contract. If it's stated in your contract that you are getting £18 per hour, that £18 is constant until you finish your 3 years. That £18 is not going to change. But in the NHS, you have a yearly review. So if you are getting £13 or £12 this year, the next year is going to be increased and the upper year is going to be increased. Apart from that, also you also get enhanced rates when you work night shifts and weekends. In the nursing home, you don't get that at all. Whether you work weekends or you work night duty, your £18 remains £18. Another advantage of working in the NHS Trust is the nurse to patient ratio. So you find out that the average number of patients that a nurse is expected to care for is about 4 to 6 patients. And you also have band 3, band 4 associate nurses, LPNs that are able to carry out basic nursing skills like checking of vital signs. So you won't really feel overloaded with work. You are able to distribute the work evenly. So at the end of the day, you don't feel stressed out. Another advantage is the benefits and incentives that comes along with working in the NHS. Now, during this COVID pandemic, a lot of discounts were going on from companies, and so many healthcare workers, especially those working in the nursing home, missed out on this because they didn't have the NHS email that comes with working with the NHS Trust. As an NHS worker, you are entitled to 6 months full pay during your maternity leave and 3 months half pay. If you are a man, you are entitled to 1 month paid paternity leave. Now, what about the sick leave? In the NHS, you are being paid your full salary, your full rate per hour during your sick leave. So you get 28 hours, 28 days paid sick leave. But in the nursing home, you only get minimum wage, which is about 8 point something, or maximum £9 per hour. Another advantage is unbiased shift patterns. For example, in the nursing home, there are some people that just choose to work certain numbers of days. Like, for example, Monday, Tuesday, and Thursday. They only work those days. They don't work weekends. But in the hospital, it's not like that. Everybody gets to do everything. So it's not like this particular person is working just weekend and this other person is off that weekend. It's off every weekend. It has to go around because they have this computer monitoring system to make sure that shifts are evenly distributed and some people are not overworked while some people are underworked. Another advantage is fair disciplinary measures. So, for example, if you have somebody bullying you, like maybe your matron, your manager, your mentor, whoever it is, you can report that person and expect that the trust is going to follow due process to bring that person to justice and to make sure that that does not repeat itself. Another advantage is the proper break times. So in the nursing home, you get your 1 hour break, but you are not really allowed to do whatever you want to do with your break. For example, you cannot leave the home premises, you cannot sleep during your break if you are on night duty. But in the NHS Trust, your 1 hour break is your 1 hour break. Whatever you want to do with it is your business. If you want to leave the hospital, if you want to sleep during your break, it's your business, as long as it is within that 1 hour time and you are back to resume when your break is over, everything is fine. And the last advantage is the development of your interpersonal and your social skills. Again, because you are working in the NHS Trust, you are exposed to different people from different backgrounds, different cultures, and different educational qualifications. So you are able to mingle and you are able to learn from each other and develop yourself as a person. Now let's move on to the cons of working in the NHS Trust, the pay cut. If you are moving from the nursing home to the NHS Trust, you will know the difference. For example, if you are earning, let's say, £18 per hour in the nursing home and then moving to the NHS Trust, you are going down to about £12 or £13 per hour. That is a huge pay cut that you have to prepare your mind for. I think that's the number one reason why a lot of people remain in the nursing home, because they are trying to see, how am I going to balance my expenses if I go from taking about £3,000 per month home and I'm going down and taking about £2,000 home? How am I going to make up the extra £1,000? But you should also know that there are also opportunities like bank shifts, like enhanced rate during weekend and night shifts that you can take to boost your income. And if you worked in the nursing home before, you can also pick up extra shifts through an agency to be able to supplement your income to meet up with the £3,000 that you've been taking home. The second disadvantage is unpaid breaks. Some care homes will pay for your break, but in the NHS Trust, you are not paid for your break because that 1 hour is for you to do whatever you want to do with. So if you are coming on a 12-hour shift, put it at the back of your mind that you are coming on an 11-hour shift. You are going to be paid just 11 hours. So that 1 hour break is not going to be paid for. So find a way to take your break at all means. The third disadvantage is paying to park your car. In the NHS, no matter how big the parking space is, even if you have like a big parking lot that is going to take another 100 cars and your car is the only car there, they are still going to ask you to pay the parking fee, which is about, let's say, £6 per day. Now imagine you're already taking a pay cut. You're already going home with £13 or £12 per hour, and then you have to pay £6 from there per day to park your car. That is another cut from your take home, which is a very big disadvantage. Another disadvantage is the pension cut. In the NHS, paying your pension is compulsory and they have a specific percentage. For example, 7.1%, which is huge. You don't really have the option of modifying it, so you can't really say that I want to opt out or I want to be contributing just 5% to my pension pot. It has to be that set figure every month, and a lot of people really don't mind, but some people think that it shouldn't be compulsory. You should also have a say of what you want to contribute to your pension pot. Now, another disadvantage is the DBS, paying for your DBS. The NHS will not pay for your DBS even though they are the one asking for it. So you have to put that at the back of your mind, that when you are applying to work in the NHS, that £30 you are going to pay for it from your pocket. Okay guys, that is a wrap for the pros and cons of the NHS hospital. Now let's go to the pros and cons of working in the nursing home. Number one, the pro of working in the nursing home is more money. The nursing home pays a high amount of money per hour. For example, £18 per hour. In the NHS, remember, you're getting like 12 or 30 pounds per hour, and then in the nursing home you're getting, let's say, 16, 17 or 15, 16, 17, 18 pounds per hour. So you see that the difference is actually huge. So that is one benefit. In the nursing home, you get to earn more as opposed to those in the NHS Trust. Another advantage is that you really don't have a lot of things to do in the nursing home. So the nursing home is actually a slow-paced environment. If you are coming as a foreign nurse and you are tensed about working in a new environment, getting to know new procedures, you can actually start off in the nursing home. It is more home friendly, it's more easier for you to fit in and learn the procedures working in the nursing home than for you to be thrown in the NHS and be exposed to so many things happening at the same time. So in the nursing home, your nursing responsibility most times will be administering medications, checking vital signs when necessary, making sure that the residents that are sick are sent to the hospital. Again, the residents in the nursing home, they are not really sick and dying. They are healthy residents that just need help with activities of daily living. So you find out that you are actually not doing a lot of nursing skills and the rest. It's just normal things that you are already used to from your home country. So it's easier for you to blend into and integrate yourself with nursing in the UK than being thrown in the NHS hospital. Another advantage to working in the nursing home is that you get to build on your leadership skills. So in the nursing home, most times you are working independently. You only rely on yourself. You have to supervise the care assistants. You have to make sure that the residents are being fed, they are taking their medications well, the sick residents are sent to the hospital. You have to follow up. So you find out that you are multitasking on almost everything at the same time. You are delegating, you are overseeing, you are reporting to your manager. So it's building yourself, your leadership skills, so that even when you move to the hospital and you are being thrown in a leadership position, or you decide to apply to a band 6 position instead of a band 5 position, those leadership skills that you've already started learning in the nursing home, you can easily pick on them and build on them in the NHS hospital. If you want to build on your leadership skill, the nursing home will help you do that faster than the NHS hospital. Another advantage is the opportunity to diversify your work experience. So a lot of people coming from outside the country to the UK, they work in the hospitals. Now, I'm from Nigeria, and in Nigeria, I don't think we have very few nursing homes. I have never seen a nursing home in Nigeria. I've only heard of hospitals and I've only worked in hospitals. So working in a nursing home now is a way to actually build my CV. So no matter where I go to in any part of the world, I can work in the hospital and also work in the nursing home because I now have experience of working in both settings. So if you want to not be restricted to just the hospital setting alone, you want to find out what it's like working in the elderly, what it's like working in a different work setting, then giving the nursing home a try should be something that you should actually think of. Another advantage of working in the nursing home is that your residents become a part of you. Because you are seeing these people every day, you start to care for them as if they are your family members. So it's kind of how do I explain this? I think you are able to give more nursing care because they are closer to you. They are not like those in the hospital that you only care for maybe one week and then they are discharged, go home, and another set of patients come in the nursing home. You kind of build a relationship with your residents, and you kind of like learn from them as well, know their likes, their dislikes, how they react to some medications. You just kind of have that nurse to patient relationship working in the nursing home, or nurse to resident relationship working in the nursing home. So let's look at the disadvantages of working in the nursing home. Number one is little or no skill improvement. So even if you are getting any skill improvement, if you are learning any skill at all, it's going to be the skills that you need to function in the nursing home, because those are the residents that you are exposed to. You are only going to be taking care of the old, the dying, so you are not really learning any skill that is going to help you in your career later. Unless you've decided to stay in the nursing home forever, you are not leaving the nursing home, you are content with working in the nursing home, then go for it, work in a nursing home as long as you want. But if you are a young aspiring nurse and you want to explore, you want to build on your strengths, you want to grow career wise, then you have to like leave the nursing home and explore other options in the hospital. Because there are times that even working in the nursing home, you begin to lose those skills that you came with. Skills like cannulation that you were very good at back in your country before coming over, because you've worked in the nursing home over time and you are not practicing those skills. You find out that by the time you want to do those skills, you're going to have a struggle with it. So that's something you should think of. Another disadvantage is that working in the nursing home can become boring over time. So you are working in this same place over and over and over. You come to work, you do the same thing, you take over, you give your medications just over and over, just like that. Because working in the nursing home, you do the same thing over and over. It's repetitive. You are not doing anything new. Nothing new ever happens, unless if you get maybe a new admission or somebody dies. And even when you get a new admission, it's still the same process. If somebody dies, it's the same process. So you are not really getting anything new. You are not getting any exciting opportunity, and over time you can get bored and just depressed and want to change setting or do something different. So working in the nursing home can become boring and repetitive over time. Another disadvantage of working in the nursing home is the nurse to patient ratio. Now you'll find out that most of the nurses working in the nursing home, they usually care for about 30 to 36 residents per day, which is about 15 to 18 residents per nurse. And if you are working night shift, most times you have to care for those residents alone with just 2 care assistants, and the care assistants are not assisting you with anything. You have to give the medications on your own, you have to check the vital signs on your own. The care assistants are only just going to put the residents to bed and keep an eye. That's just it. So most times, most of the nursing and clinical judgment, clinical skills and everything, nursing skills and all, is going to be carried out by you. So at the end of the day, you might be feeling stressed out because you really don't have a lot to do in nursing home, but because you are caring for that number of residents, you can easily feel worn out at the end of the day. Now another disadvantage has to do with the salary. Now I know I already said that the salary is part of the advantages, but the salary is also part of the disadvantages. Now let me break it down. For your NHS, remember you have the upward review of your salary in the NHS, but in the nursing home, your salary is constant. No matter how hard you work, your salary is constant. If you are coming in with £18 per hour, you have to continue getting that £18 per hour until you change your contract, until your contract expires, or until you apply to another position with a higher salary range. But if you are coming in with £18 per hour on your contract, that is what you are entitled to. That is what you are going to get, full stop. There is no weekend or night duty enhanced rate. The only enhanced rate that you are getting is just when you work overtime and during public holidays. So guys, in summary, if you want to make more money, work in the nursing home. If you want to gain more experience, more exposure, work in the NHS hospital. I hope you have enjoyed this video. This video is actually a summary of the live stream that I did with another nurse, David. David worked in the nursing home for some time and then decided that the nursing home was not for him, and he moved to the NHS hospital. So this video is the summary of the live stream that was done on Facebook about this topic, and I'm aware that a lot of people won't be able to watch the full live stream, the full video, because of the internet cost. So I decided to make a summary of it, and here it is. So if you watch this video and you still want to watch the full video, I will actually encourage you to watch the full video, because I didn't really expand. David expanded on each point, I only summarized it. So if you really want to get the full information, if you want to make a full decision, a full informed decision, I'm going to leave the link of the video here. Click on it. I'm going to split it in two, part 1 and part 2, because it's actually a long video. I wanted to do the live stream on YouTube, which was going to be easier for me, but I'm still not eligible to get my live stream on yet. And also guys, thank you so much for 1,000 subscribers. I love you guys. If you also want to see a video about how a typical day at work is in a nursing home, also watch it here. I'm going to leave the link here and also in the description box. Thank you so much. I love you guys, and I look forward to another session with you guys. Bye.